As it stands, there is a shortage of nurses in the UK. We are therefore heavily reliant on recruiting nurses and other care staff from the EU and from across the world. 9.1% of our doctors and 6% of our nurses are EU nationals. EU nationals also make up just shy of 6% of scientific staff. Between 2009 and 2016, the percentage of nurses in the UK who were EU nationals rose. However, from 2016 onward, it would fall. A significant proportion of EU nationals who work in the NHS are working in London, around 1/3. This means that they make up 11% of the total NHS staff in London. In the UK as a whole, there are 32 trusts where more than 10% of staff are EU nationals, with the majority being in the southeast of England, including London. The majority of the EU nationals working in the NHS come from older EU member states, those that joined before 2004, like Italy and Spain, rather than newer member states that joined since 2004, like Poland or Romania. In the year before the Brexit vote, 11% of those joining the NHS, looking at all staff groups, were EU nationals. By 2019, this had fallen to just 7%. Looking specifically at nurses, 19% of those that joined the NHS in the year before the Brexit referendum were EU nationals. But by 2019, this number had dropped to 6%. In contrast to this, the proportion of nurses joining the NHS from outside the EU rose, from 8% in 2015-2016 to 22% in 2019. Given the crucial role that immigration has played in the past, the UK faces a tough situation since the Brexit vote of 2016. There are now 90% fewer nurses and midwives from the EU joining the NMC, the Nursing and Midwifery Council Register, than there had been in the years before the Brexit referendum. More than 10,000 nurses of EU nationality have already left the UK. The NMC has stated that 51% of EU national or EU-trained nurses that have left the nursing profession in the UK cited worries and concerns around Brexit as being a key contributing factor in their decision to leave. In fact, nurses and health visitors are the only group of NHS staff that have had a drop in numbers in EU nationals since the referendum. Across other staff groups, the percentage of staff from the EU has actually risen, despite concerns over Brexit. Doctors have fallen from a peak that occurred after the Brexit referendum. The immigration system must respect the importance of international migrants to the healthcare system in the UK. The UK should be seen as an attractive place to work for nurses that will reward them and understand their worth. Immigration should be transparent and fair and must focus on the skills that are especially needed. Thought must be given to both healthcare and social work. It should be easy to understand and to navigate, and it should be simple to seek help with any aspect of it, in order that nurses across the world are not turned away by a needlessly opaque or hard-to-use system. Skills should be made the principal focus, rather than salaries. Crucially, whilst international nurses are vital to the function of the NHS, we must not forget the role that home-trained nurses can also have. It is vital that the UK has the systems in place to train an adequate body of staff for its needs without an over-reliance on workers from abroad. This could be unsustainable and lead to difficulties further down the line as systems or prospects in other countries change and the international workforce shift from the UK towards other countries or their own. What do you know about the number of nurses that are employed by the NHS who come from Europe versus UK nationals? Why is it important that the UK trains its own nurses as well as having EU and international born nurses? What impact do you think Brexit has had on staffing in the NHS? What is the current state of staffing in the NHS?